Inland Imaging's outpatient-based interventional lab is a state-of-the-art facility located at Inland Imaging's Holy Family Imaging Center in Spokane, Washington. The lab provides the most sophisticated and streamlined patient care available in an outpatient setting and is the first of its kind in the country to utilize GE's Discovery interventional technology. Recently, patient Cornelius Keith Hoganout came to Inland Imaging's Dr. Jason Brower seeking a minimally invasive prostate embolization for treatment of an enlarged prostate. This is his story.
The patient that was referred to us actually came, in a sense, self-referred. He did a lot of online education. When he went to his urologist to talk about options, he really presented this as the direction that he wanted to go.
Then I went in to see the urologist and he suggested a TURP, but I said, no, I'd like to have a PAE. So he referred me to Dr. Brower.
Like a lot of men, once you reach a certain age, your prostate, which sits down at the base of your bladder, starts to enlarge. If that happens, it has the potential of constricting the outflow of the urine. To this point, the traditional treatment has been surgical in that they go in and actually core out a piece of that prostate gland.
About 4 years ago, my urologist said, you know, you've got a little, and I was having a little problem just going to the bathroom at that point. And he says that we're going to do a laser treatment on you. So I had a laser treatment, and they used a big button laser, and I wound up in the hospital overnight with it, and I spent about a month and a half bleeding after that.
And so what we've pioneered over the course of the last few years, and not just us, our society and our specialty, is blocking up the blood vessels that go to the prostate. So instead of having a large surgical procedure to remove a portion of that prostate, you can have a minor outpatient procedure to plug up the blood vessels, shrink the prostate, and then open up that flow of urine again.
Well, having had both a procedure similar to the TURP with the laser and then going in for this procedure, it was a night and day difference.
The way that we treat men's prostates when they enlarge is by actually doing a procedure initially called an angiogram, where we take a small plastic tube, insert it into the blood vessels that feed the prostate gland, take pictures of those blood vessels.
Doing all kinds of research, and I found a doctor in Portugal who had done something called a PAE. And I said, wow, what's that? You know, and I read up on it, and I found out that they use an embolizing agent, and the embolizing agent stops the blood flow to the prostate, and the prostate shrinks.
So once we've identified the blood vessels that go to the prostate gland, we can plug them up with small little particles. And what that does then is it starves the prostate of blood and nutrients, causes it to shrink down over time. So instead of actually having to surgically remove part of that prostate, just by plugging up those blood vessels, we cause it to shrink down. The recovery's faster, less painful. There's no catheter that's needed oftentimes after the procedure, as in surgically, the patients oftentimes do need that catheter.
To me, somebody that has a problem and he's thinking about getting a TURP or thinking of doing another, what's relatively a more invasive procedure than the one that I went through, should consider doing this as well. I mean, it may not work for everybody, but it sure worked for me. And it would be great to see other people take advantage of it, because it's a lot easier on you. And you know, you go in and you get it done and you go home the same day. And there's no catheter that's left in there. You're not sitting around bleeding like you would with some of the other procedures.
This was the absolute ideal outcome. Quick recovery time, usually in a matter of about 1 to 2 weeks, any of the residual symptoms are resolved. And then over time, by about month 3, the prostate starts to really shrink down. And somewhere between 3 to 6 months is when we see our maximal effect. In this patient's case, we started to see results almost immediately within the first month or 2, and now he has no residual symptoms at all related to his enlarged prostate.
If you've got this problem, this is a heck of a good way to fix it and get a nice fix, an easy fix, without a lot of side issues. So I'm just tickled with my results.
The benefit of going to the outpatient facility at Holy Family is you avoid a lot of the hassles and potential complications of coming into the hospital. Parking's easy. You only have to check in about a half an hour ahead of time instead of several hours as we have our patients check in here at the hospital. There's no emergency cases that are going to bump your procedure and make our start time later. So it's very convenient, it's easy, and oftentimes it's less costly to have the procedure done in that outpatient setting. We have state-of-the-art equipment in our new lab, so anything we can do in the hospital, we can do in this lab. Some of the other procedures that we're actually doing in the lab are angiogram procedures, where we look at blood vessels. We're doing all sorts of cancer therapy, whether it's directed at the liver, whether it's directed at other places where potentially patients have cancer. Again, it's that opportunity to work hand in hand with the referring physicians to drive the best outcomes for our patients.
Inland Imaging would welcome the opportunity to meet to discuss in more detail the procedures we are able to perform, as well as the benefits we can provide to our referring providers and their patients. To learn more, go to interventional.inlandimaging.com or contact our Interventional Radiology Clinic at 509-363-7554.